The government last month announced ambitious targets for the country's immunization drive. It intends to vaccinate all the people above the age of 30 at the end of September this year. A key component in achieving this is the vaccine availability. To that end, another batch of 1 million doses of the Sinopharm vaccine arrived in the island during the early hours of today. It is part of a 2 million dose purchase order placed by the State Pharmaceuticals Corporation. The island has received a total of 4.1 million doses of the China-manufactured jab since the first consignment of 600,000 doses arrived in the country earlier in March this year. Health authorities have been able to administer at least one dose of the Sinopharm vaccine to over 1.9 million people so far. What's more, the Ministry of Health urged the general public to stay patient and follow suit when coming to receive the vaccine, as the national immunization program is conducted island-wide. Meanwhile, President Gotabaya Rajapaksa instructed health officials to vaccinate all the people above the age of 30 in the Western Province before the 31st of July. The President's media division says that 60% of the people belonging to this age group in the Colombo district, 47% in the Gampar district and 34% in the Kalutar district are at least given one dose of a vaccine against COVID-19. The President emphasized the need to inoculate a higher percentage of people across the country before September in a systematic manner. The head of state also expressed confidence that Sri Lanka would soon receive the required amount of AstraZeneca vaccines for the administration of the second dose and instructed health officials to make arrangements to roll out the vaccine. Meanwhile, yesterday was another good day on the daily inoculation front, with a total of 169,957 vaccinations done. A total of 100,065 persons received the first dose of the Sinopharm jab, while 66,220 were administered with the second dose of the same vaccine. The second dose of the AstraZeneca vaccine, meanwhile, was given to 3,672 people yesterday. Since the detection of 5 COVID patients with the Delta variant on the 17th of last month from Dematagoda, concerns have been high. Since then, there have been several suspected Delta cases detected from Kotte and Kahathuduwa. But for now, there remain to be suspected Delta cases and nothing more.
So far, the situation is there were 5 confirmed cases and the number has not increased since yet. However, there are few other cases where a suspicion is there and are being monitored, where we are awaiting the final gene sequencing results, which is expected in near future. However, even with the suspicion, the relevant and appropriate preventative measures have been taken. Stringent quarantine and isolation has been imposed on these areas and the individuals and their household members. Further testing for gene sequencing of the initial contacts also has been completed. And when these results of gene sequencing are available, we will be informing you in due course.
In the meantime, the strike launched by several nurses' trade unions continues for a second day today. The Public Service United Nurses Union, the Government Nursing Officers Association and the All Ceylon Nurses Association have opted to take trade union action amid the pandemic over several demands. They demand that promotions be given every 5 years, a shift-based work schedule similar to that of government institutions, and solutions to the issues they face in battling the pandemic be looked into. Hospitals island-wide were crippled by the move today as well, with the exception of hospitals and treatment centres dedicated for COVID treatment, women and children's hospitals and the Apeksha Hospital in Maharagama. Given the timing of the strike, the Ministry of Health urges them to reconsider and resolve their issues via talks without jeopardizing the progress made in curbing the virus spread.
Health Ministry always respect their right to take the trade union actions and to protect their rights and privileges. However, I would like to urge all the members of the health profession as well as health workers who are working in the control activities related to COVID-19 as well as other health related activities to be restrained and then resolve your issues by discussion and by consensus, so that the minimal inconvenience will be caused to the public, and we should not leave any room for this common enemy to spread and create problems to the entire health system, as well as to reduce the level of protection that is faced by the general public.
Meanwhile, yesterday 1,883 fresh COVID-19 cases were confirmed across the country. The Western Province topped the list of cases with 809. Among the 3 districts of the province, the majority of cases were reported from the Gampa district with 342. Meanwhile, 68 imported cases were also confirmed across treatment centers yesterday. As for today, 1,102 fresh cases have been confirmed in the island so far, placing the number of active cases in Sri Lanka at 29,413. As for recoveries, there were 1,701 today, taking the overall tally to 229,541.
Pocket එකට ෆිට් වෙන new Axe Ticket perfume.